Hello and welcome everyone in a new video about neuroradiology. In today's video we are going to talk about emergency radiology, and in this case we are going to talk about the skull fracture, and also we are going to talk about different types of fracture and skull fractures that we have, and subdural hematoma, and also the acute epidural hematoma. Okay, so let's get started. So, the skull fracture. The cause of the skull fracture is basically a direct blunt trauma to the skull, as we will see in figure 2. The CT findings in this case are the followings. The CT findings can be classified according to the fracture that we have into linear fracture and depressed fracture. Linear fracture is sharp loosened line with no depression of the fracture fragment or fragments. The depressed one, however, is the fracture fragments are depressed inward in this case. So let's take a look at this photo below. So in the photo on the right side, we can see on the occipital bone linear fracture, as you can see this line here, which shows that there is a linear fracture, shown by the arrow, by the way. And on the picture on the left, we can see two linear fractures. This first linear fracture on the occipital bone, and this linear fracture on the base of the skull. I think this is a basal skull fracture. By the way, you know that the basal skull fracture can cause for you different symptoms like the raccoon eyes, and also the leakage of the CSF from the ears and so on. Okay, so let's continue and let's talk about the depressed fractures. Here in this picture we can see the depressed fracture. As we said earlier, that the depressed fracture in this case is going to be fragmented into one fragment or more, and this is how we can differentiate between that, and it's going to be depressed inward. And this is not the only thing. So we can see here in this picture, there is one fragment and there is two fragments. So two fragments in total, and these are depressed inside, as shown by the arrow. But this is not the only thing that we can see here. We can see something else, and that is a hematoma. This black thing is nothing but blood accumulating here, because you see that it is it shows a black area, while you can't see that in other areas, and this tells us that how long it's been like that. And I can tell that this is probably subacute hemorrhage that is happening here. And anyway, we are going to talk about this in a moment. Okay, so let's continue. So yeah, everyone. Then we have two different types of fracture. This is the depressed fracture, and the other one was the linear fracture, and this is how we can differentiate between the two. Here we are going to talk about the subdural hematoma. Well, the subdural hematoma, about the location, 95% occur in the frontotemporal region. Okay, and the cause is most likely due to venous bleeding from tearing of the bridging veins, and this is happening due to trauma of different types. This is the most common cause. The CT findings, which is our point of interest, is view and blood window setting. So what blood windows do we have? We have at the width of 250 and the level 40. We can see that there is bleeding, usually in the case of subdural hematoma. Crescentic in shape. We will see that. You see this thing here in figure A, it's crescent in shape. This subdural hematoma is crescent in shape, as you can see. Okay. third thing here often extends into the interhemispheric suture and along tentorium. So always the tentorium and the interhemispheric suture is going to be involved in the case of subdural hematoma. Can cross suture lines, not the midlines. So the suture line, which is here, around here, can be crossed. This is the suture that separates different lobes. For example, the frontal and parietal lobe are separated by this suture. So it's going to be crossed in the cases of subdural hematoma, while the midline, which is this one, cannot be crossed. Okay, but for example, in the cases of tumors, it can be crossed. Then we have in the tumor we have midline shift, something called midline shift. Okay, the next thing is can cross. We talked about can cross suture lines, not midlines. And the next thing is look for effacement of sulci. Now, what do we mean? What do we mean by effacement of sulci? Just take a look at picture C. Here on this side, on the right side of the photo, and on the left side of the photo. On the left side of the photo, it's normal. It looks normal, right? So because you see this sulci here, they have a higher radiological density on the CT scan right here, which makes the sulci here different than the other tissue and everything. So you can see the difference here. But here we can see the loss of the sulci effacement because of the bleeding, of course. So that's why we have something called look for the effacement of sulci. We have a loss of the effacement of the sulci. Okay, so let's take a look at these pictures. First, A. In picture A, we can see semilunar shape hematoma, which is the subdural hematoma. You can see it subdural, and it is white because blood will look white on the CT scan because it has hemoglobin and it's high Z material, and the molecular weight is high. It looks white. In picture B, however, it becomes black. It becomes black, and that will tell us that this is the period that is passing through is taking longer. So it's been a while when the CT shows this sign, which is turning the hematoma into black color, then it means that it took some time. For example, could be subacute hematoma. Okay. Picture C, we can see that here we have loss of the effacements of the sulci. This is another sign, and we can see that clearly. Here there is no effacement, here the effacement is still present, here the effacement is still present, as shown by the arrows. And the next point, here we have D. D, in this area, we can see that there is areas with mixed attenuations. So we have some of them with low attenuation, some of them, a little bit of them, are with high attenuation. Okay, so we are gonna actually explain that now. So let's read what's written here to understand more. So A says it's an axial CT shows a hyperdense acute subdural hematoma along the left hemisphere. Okay, so this is still acute. In figure B, however, in figure B, this is A, this is B. In figure B, we can see axial CT shows isodense subacute subdural hematoma along the left hemisphere. So now it's what? In B, it's subacute. There, it was acute, now it is subacute. When it turns black, it is subacute. Then C, axial CT shows hypodense chronic subdural hematoma along the right hemisphere. Okay, so here we can see this is becoming chronic. When the effacement of the sulci is lost and the density is similar and the effacement is lost, then we can say that this is what? This is getting chronic. And of course in D we can see axial CT shows an acute on chronic mixed subdural hematoma. Now I will say how that's acute and chronic at the same time. Well, this area which lost the effacement, basically, okay, with the same color, which is like isodens kind of, which is similar kind of to the brain tissue itself. This is an area for chronic hemorrhage. Then you'll say, well, where is the acute? Well, the answer is simple. Look around the brain. This area which is black, this area which is black is different than this area, and it is not the same density of the brain. So this is a blood. This black area is small here. This black area, this is a blood, and this blood, it is acute, considered acute. Although that the black in B considered chronic, but in this case the black in D it's considered acute, and this area which is isodense is the chronic. So that's how we say that this, well, it's a mixture between acute and chronic subdural hematoma. That's it for subdural hematoma. We're going to talk about the next topic here. The next topic here is actually the acute epidural hematoma. Well, first about the location. 70 to 75% occur in temporoparietal region. Okay, it happens in the temporoparietal region. What about the cause? Most likely caused by laceration of the middle meningeal artery. Okay, in children, it could be due to tearing of venous sinuses. So, well, the laceration of the middle meningeal artery, always the middle meningeal artery is the one that is responsible for all the problems regarding hemorrhages, ischemias, everything, aneurysms, everything. And from the other things, for example, the most common artery for it to have an aneurysm is the middle meningeal artery, and and also other arteries are also involved. In children, it could be due to tearing of venous sinuses. So when does the tearing of venous sinuses happen? For example, in the case of delivery. Which type of delivery? Delivery using forceps. When you deliver a baby using forceps and pull the baby out of the uterus, you are increasing the chances of him getting a trauma, and the trauma will lead to tearing of the venous sinuses and lead to acute epidural hematoma. This is the cause of acute epidural hematoma. What about the CT finding, which is the most interesting for us? Usually associates with underlying fractures about 85 to 95%. Okay, does not cross suture line but can cross the midline. So it does not the subdural hematoma, or sorry, the epidural hematoma. It does not cross the suture line. Okay, it does not cross the suture line, but can cross the midline, and if it crosses the midline, it means midline shift. While with the case of subdural hematoma, it cannot cross the midline, but it can cross the suture line. So this is how you differentiate between the two. In subdural, it can cross the suture line but not the midline, but in the case of epidural, it can cross the midline but not the suture line. However, I don't really go with that sometimes. What I prefer is what we call the lens shape, if you know. Here it says 3, it is the biconvex shape, which is the lens shape, I call it. So the shape of it looks like a lens, so it's biconvex. The next point, the fourth point, is the swirl sign. What about the swirl sign? Mixed areas of high and low attenuation is indicative of an acute bleeding. So here you can see there is this white space spot is a high. This is high attenuation and this is low attenuation. So white and black. So you can see the mixture between them at the same area, and this will indicate for you that there is an acute bleeding. And anyway, the most important thing that you see a lens shape, not the semilunar shape, but a lens shape, then you can say that it is subdural hematoma, okay, or sorry, epidural hematoma. Anyway, okay, so yeah, I think that's it for now, and thank you for watching. If you have any questions, you can post them in the comments. We can discuss them, and yeah, thank you. And if you like this video, make sure to press the like button and subscribe for more videos. For the next video, we're going to talk about carbon monoxide poisoning and other important topics that will be covered deeply in neuroradiology section. Thanks for watching, and